Now, new research which aims to reduce the risk of misdiagnosing patients' health conditions and have ultimately saved lives.
Failing to correctly identify complaints, so things like rashes, scars or jaundice, is higher amongst people of darker skin tones. So now it's hoped that a new library of images will help medics to spot the dangers early. Richard Payne reports.
Giving healthcare professionals a helping hand. Quickly and correctly identifying a vast range of conditions can be crucial to successful treatment. But experts say for those with darker skin, the odds on correct diagnosis have been reduced until now.
Jaundice is notoriously difficult to diagnose, and if you are not used to knowing where to look for jaundice in people with darker skin tones, then it's very difficult to diagnose it. So you can see in this image, for instance, the roof of the mouth is slightly yellow, and that is exactly where you would look for it in a child with darker skin. We have a very diverse population in the UK, and we should be able to reflect that in our imagery that we use for teaching clinicians.
And potentially save lives.
Yeah, ultimately.
Judith Davis is one of 150 people who volunteered to be photographed in their communities to help reduce health inequalities for those with different skin tones.
There's marks and stuff on my body that I've never known what it's about, and this also seemed to be that opportunity that I may get an answer. I think sometimes there's been a bit of self-diagnosis going on, or no diagnosis because nobody knew what it was. But jaundice is an example. We've had jaundice in the past, and one child, I would say, got recognised and another young person didn't.
2 years of work by the NHS and the University of the West of England, Bristol, has resulted in 3,000 images in a library free to download and to inform a national audience.
When we looked for pictures of medical conditions, we just noticed they were predominantly of people with white skin. And equally, when we looked for images of our own professions, so I'm a physiotherapist by trade, when I looked for pictures of physiotherapists, again, they were very much biased towards people with white skin. So that's kind of how it all started. We thought about how great it would be if actually we had a resource that was diverse and inclusive and represented the communities that healthcare serve.
Contributing to a project that is, quite literally in some cases, changing the face of medicine. Richard Payne, ITV News, Bristol.
And you are watching ITV News in the West Country with Seb and Alex.